SI18, bladder 2, GB14. That's okay. You okay? Oh, let's point camera.
Identical.
So it's quite a bit of B12 and like and folic acid, methylfolate.
So it's a mixture of
So I'm gonna
you are doing
a little bit deep here when we get to
it's not the same as mine, is it? Because
No.
he has this how do you call it?
Stiff neck.
Stiff neck.
Yes, he has a stiff neck. I can see that.
He's been going for many years. Lehernya ini begini sudah lama sekali kan, Mas?
2002.
See, 10 years. Starting from C12, is it? Sorry, T12. Have you tried this on HIV patient?
HIV?
Yeah. or Hep C,
Hep C, yes.
and you do the liver part and the whole body thing, or
So-
I wasn't able to do.
But you have the-
chemotherapy.
You have the
So I do the rectal,
right. You do the honestly I think
and it
it's better.
feels great.
I
It
think
feels
it's better.
great.
Like why ozonate the blood? So complicated. So much blood. So much equipment. Risks, right? There's risks. You get the same effect as doing it rectally.
It is.
Rectal injection of
Yeah,
ozone.
you do like 60 cc's.
Mhm.
That 60 cc syringe. Rectally, you do 2 of those, right? 2.
I use catheter with a bag,
Yeah.
with an insufferable bag, with one line
Mhm.
for the ozone to go
Mhm.
in, but there's a valve that it can go back again,
Mhm.
and another one that he can actually adjust it,
Mm.
so he can pump in the ozone gas
By himself.
by himself, so he can adjust it,
Mhm.
and we stay there for 15 minutes, 20 minutes, and it feels great.
So try, you know the herb astragalus?
I have to write it down. Strugglers,
Huangqi.
Huang Qi.
Yeah, with the Melsman. I have a formula for, we'll get the
Oh,
formula
yeah.
for
Please.
the liver formula
Mhm.
because Huangqi is in that formula.
Agak sensitif ya.
Iya kok.
Napas panjang aja ngomong sama diri sendiri bilang saya perlu ini. Yeah, I did talk to myself that I need this. I tell my body as if I'm talking to you. You need this. You really need this, and it will help you. It will help you a lot. So relax, and then I just relax.
Mhm.
Oh, the sound there. Okay. Deep, huh?
But see, my finger's deep. Don't hit your finger. You can, if you're going really slow, you can. I still rather not hit myself.
Oh, yeah, I know.
That's why I'm doing that like this.
Oblique.
See, twitch. In a way that you should be able to do this tomorrow.
Mhm.
This is very straightforward. So scapular spine, you can big knot there. So this is a very safe area.
When
the
you-
lung is
Is
here. So we're going here.
it's very safe.
So I can go with 3-inch needles. That's
Very painful. Intra-articular injection, sometimes it helps, sometimes it doesn't really help.
for where?
That's what you do
The shoulder,
from here.
the back.
Yeah, there's the processes here,
Yeah.
and also here,
Go from the back.
from here.
SI 10
How deep?
to the bone.
And I
So-
really rarely.
So spinous process.
The 7 is it?
That's 6,
6
That's
or 7 is there.
5. So I'm going to do 5, 6. Very
5
safe.
and 6.
So spinous process.
Yeah,
That
that's where
depth, that's lamina,
the.
facet joint. So I do the lamina.
So 1 inch in the back.
So tapping, I'm on the lamina.
Yeah, you can hear the
It's okay.
napas. Napas.
You're doing good. Last one.
Flipper.
On solid bone.
Oh, you actually touch the bone.
Yeah. On solid bone.
You to lift it up.
No.
No?
You lift it like this. Perfect. See?
The scapula. Oh, the edge of the space. Okay.
Relaxing.
Yeah. Relax ya, relax.
He doesn't understand that, right?
Kasih lemasin. Ya.
Hold on.
I see. One more time. Relax lagi, kasih lemas lagi ya, biar dia yang angkat.
Those are highly emotional points. You can see
Follow the bone down, and you'll see the bone starts to curve right here.
Okay.
That's a very good indicator as to where the Jusan is.
Tell me what she's doing.
Acupuncture
Your
injection.
thumb is one Chinese
in the needle?
inch.
Placental
of
extract.
shin.
You should get
So
some
you
also.
would place, once you locate your point there, you would place your thumb one finger breadth from the bone, okay? And that's where you're going to find your Jusan Li point.
This is the most essential point
The
for
most-
all placental treatment here.
Yes.
The Jusan Li can do so many functions. Stop pain, help the body produce blood, tonify, many indications.
Mãe, esse é o ponto mais importante de todos. Que tira a inflamação.
Mas nesse joelho?
Sangue, sim. Todo o corpo.
Mas
Pra
ela não
equilíbrio-
fez nesse.
Não, para equilíbrio energético.
Não, nesse joelho ela não fez.
Joga tudo
Now this is the spleen 6, okay? You find the prominence of the malleolus, ankle bone,
Okay.
and you're going to do your same measurement. 3 Chinese inches is 4 fingers. Now, everybody's measurements are a little bit different. So if your hands are smaller than the patient, just kind of measure your hands on the patient's body and see if you have to go up or down a little bit. But as a general rule, 3 from the prominence of the malleolus. You place your hand there, go next to the bone and feel. Most patients will tell you, "Ay, duele." Oh, a swan, in Chinese, a swan,
Yes.
sore. So, and then if you can see that you sink down into the area, that's, you know. Look for the indentations, the bones, So feel that.
Ok.
Ella dice que ella inyecta esta pierna para tratar de pasar energía hacia el ojo, que está inflamada también.
Then I think the therapy is very fantastic. I'd like if I can to make more one today. My daughter make and you only see because I can to have the to know if it's be able.
Sí, yo soy
She's
la
be able.
maestra, pues. I will teach
She's
you.
be able to make in Brazil.
Yes, I will. You leg cream.
Tell me, what was it yesterday? What happened yesterday? How big was it?
Was with inflammation,
problem to
was
make-
red and very pain. Today it's get down and the pain is better.
Swelling is reduced dramatically after first injection.
First application is very bad. Yes.
Y ella queriendo ya que es problemático hacerse los dos
Uli
días.
came yesterday and asked for AIT treatment, and when she presented, her knee was very swollen, and there was a lot of fluid in the area. And I treated basically what we call the Ashur points, the painful points, and then I also chose traditional Chinese points that are specific for knee pain. The top of the knee point is called Hegu. Weibuchi. The top of the knee point is called He Ding. And this is a very powerful point for people that have knee pain. Also, the eyes of the knee are called the Yu Yao or the Du Bi, which is in Chinese means face of baby calf. And these points are very, very powerful in reducing inflammation and dissipating pain. I also chose spleen 6 because spleen 6 is the San Yin Jiao, which means that it treats the 3 yin points on this meridian. So this is very effective in relieving pain. Also, it also acts as a draining point so that it pulls toxicity from the body. It's a very, very powerful command point. I also used Dusanli. And did we do the points on the hands too? Yes. We did the Hegu, which is the large intestine meridian, and the Li Chi, which is also another point on the large intestine and meridian. I used the Qi Hai on the abdomen so that we could have some movement of Qi also to move the pain. So today she's presenting, she indicates that she has no pain today, but would like to follow through with another treatment so that we can reduce the inflammation. So today what I might do is I'll treat the local area, but I'd like to treat some points on the opposite leg that are more powerful today that we can send energy over to the contralateral side.
Okay.
The knee still feels a little hot, so we're going to use the Li11 point.
You can do the injection for her now actually.
It's a very strong
While she's on the numb cream. Apply the numb cream for her
I'll do
first.
some local points around this area, and we'll work on the opposite side. Okay? What I do is I try to feel for some of the acupuncture points. This point here is also a spleen point that's very powerful, and this point will actually cool the blood. This is spleen 10. So let's start here. We can use the spleen points. I'd also like to reinforce the tendons in her body because her cruciate ligament is gone. So we need the body to send the energy to where these tendons used to be. Because even though you don't have the tendon, the body will still have cell memory that is there. So that could possibly help that. Okay.
Why is Daisy
How deep you inject? Like
Sub-Q or IM, depending on the location.
okay. The linkage is here. That's 30 gauge, right? The right
30 gauge
linkage
half.
to
31.
do that.
The linkage?
Yes.
Yeah, okay, yeah. If you take your hand like this and you place it on top of the knee, where the thumb falls into the little crevice, you will find that location.
Maybe Dr. Cheryl, you can go to the head so that if there are new people coming, you can entertain
You
them.
find it?
Right here.
Put your hand on top of your knee. Where the thumb falls, you're going to find a little crevice right in here, right next to the bone. Okay?
She had a conflict of the Korean. Basically a general
That's called spleen 10. Okay? Now, spleen 9 is just below it in this little crevice in here, okay?
don't have to really use it regularly.
Okay.
The placenta, let it work.
So you inject 0. ml per point.
I just choose maybe two levels of the bar.
2 levels.
So 0.2 ml.
0.2. Okay. I'm sorry, I didn't measure it before. So. Now, to find this is the command point for the tendons. It's gallbladder 34. You would find the epicondyle here of this bone, right here, the round part of the bone. Okay. Always near bones, you're going to sink down into a fleshy area that opens up. And that's how you find gallbladder 34. And gallbladder 34 is a very powerful tendon. It's what we call command points. To strongly effectuate knee pain. So what I'm going to do is maybe just move around a little bit and find the tip of that knee, and I'm going to go down and just go underneath the patella just slightly.
like a 45 degree.
Sure. And you could also do, I mean, if you had a lot of pain and inflammation, you could actually do a different type of insertion and do a fanning technique to fan all the way around it. And actually, I think we'll try that the other way, just to get a little bit more fluid at the top where it seems to be a little bit of more inflammation. It's all on the stomach meridians. The stomach meridians the stomach meridians are very powerful in stopping pain. So I really want to get back in there again. So we're going to locate, what they say is the dubi. If you can picture the face of a cow, el cara de vaca, ¿sí? And este puente de cara de vaca is como aquí. ¿Sí? Okay. Just push your finger right in there, and you'll feel that opening.
Yes. It should be closed.
No, it's open. It's just a locator point,
Here too.
Yes.
El punto se llama cara de vaca.
Study the culture, and this medicine was developed by people 4,000 or 5,000 years ago that had no medical training. They had no education other than what they knew from the 5 elements of the earth and what they observed. And if you look at the Chinese names, they're very descriptive of a well, a pond, something that resembles water or wind. And these areas, are in a bony structure that represents almost like a little crevice that you go into. And you'll find that most of the chi for the body is near these areas. Follow the bone down, and you'll see the bone starts to curve right here.
Okay.
That's a very good indicator as to where the Jusan leads.
Tell me what she's doing.
Acupuncture
Your
injection.
thumb is one Chinese inch.
Some central
of chin.
extract. You should get
So
some
you
also.
would place, once you locate your point there, you would place your thumb 1 finger breadth from the bone. Okay? And that's where you're going to find your Jusan Li point.
This is the most essential point for all placental treatment here.
Yes.
The Jusan Li can do so many functions. Stop pain, help the body produce blood, tonify, many indications.
Mãe, esse é o ponto mais importante de todos, que tira a inflamação,
Mas nesse joelho?
sangue, sim, todo o corpo.
Mas ela não fez nesse.
Não, tem equilíbrio energético.
Não, nesse joelho ela não fez.
Now this is the spleen 6, okay? You find the prominence of the malleolus, ankle bone,
Okay?
and you're going to do your same measurement. 3 Chinese inches is 4 fingers. Now, everybody's measurements are a little bit different. So if your hands are smaller than the patient, just kind of measure your hands on the patient's body and see if you have to go up or down a little bit. But as a general rule, 3 chin from the prominence of the malleolus. You place your hand there, go next to the bone and feel. Most patients will tell you, "Ay, duele." Ooh, a swan, in Chinese, a swan.
Yes.
Sore. So, and then if you can see that you sink down into the area, that's, you know. Look for the indentations, the bones, So feel that.
Ok.
Ella dice que ella inyecta esta pierna para tratar de pasar energía hacia el ojo, que está inflamada también.
Yes, it's like constant.
Y hoy le está inyectando esto para llegar
So you are one of principals?
Yes, sir.
Let's move up here.
Give me your card.
friegue. Sí, oye, con México.
This is large intestine 4. Okay? Same concept. Look for the crease, find the bones, and go right in the middle.
Okay.
Closer to the bone. This is a very, very
Find the
good
bones.
yeah.
This one. Find the bone.
And just come over just equal with the end of the crease. Now this is a very sensitive
It's not
point.
yesterday.